Hi everyone, hope you are doing well. Today we are going to discuss about immunoelectrophoresis. The term immunoelectrophoresis was coined by Graber and Williams in 1953. Abbreviated as IEP, this technique did create a breakthrough in protein identification in immunological studies. It refers to separation and identification of our antigen of interest from the provided mixture based on their charge and size. This resolution is assisted and empowered essentially by an electric field as suggested by the technique name. IEP involves two steps, that is electrophoresis, which is immediately followed by immunodiffusion. The sample containing the antigen is loaded into the well cut in the gel near the cathode end of the slide and electrophoresed. Subsequently, one or two thin troughs are then carefully cut in the gel parallel to the direction of electrophoresis of the sample. Antibodies are filled in these troughs, which essentially are specific to the antigen of our interest. When left undisturbed in a humid chamber, these antibodies diffuse laterally to meet diffusing antigens. Due to diffusion, a differential density of the antigen and antibody is created within the gel, and precisely at the equivalence point, clear white arcs of the immune complex form after prolonged incubation. Each of these indicate the reaction between the individual protein antigens with the respective antibodies. To perform immunoelectrophoresis, we need to follow this procedure. 10 ml of 1.5% agarose slurry is prepared, from which a gel is casted on a glass slide. A well is bored on one side of the slide, which would be the cathode side, while performing electrophoresis. The sample, that is antigen mixture, is loaded in this well. The gel is placed into the electrophoresis chamber with the well containing the sample at the cathodic side, and electrophoresis is carried out at about 100 volts for 30 to 40 minutes. The blue tracking dye should travel at least 4 to 5 cm by this time. After completion of electrophoresis, the slide is taken out and troughs are horizontally cut above and below the electrophoresis axis, and add 80 microliter each of 2 antisera in the two troughs. The setup is incubated overnight in a moist chamber, undisturbed at room temperature in a horizontal position. The gel may be observed for the precipitin arcs, or for better visualization, may even be stained with a protein staining reagent such as Kumasi Brilliant Blue for about 3 minutes, followed by decolorizing the gel for 5 to 10 minutes in a destaining solution. The gel is evaluated for results and may even be dried if it needs to be preserved. The presence of elliptical precipitin arcs represents antigen-antibody interaction. The absence of the formation of precipitates suggests the absence of the antigen in the given sample, and different antigens can be identified based on the location, intensity, and shape of the precipitation lines. The applications of this technique are as follows. The test helps in the identification and approximate quantization of various proteins present in the serum. It is used in patients with suspected monoclonal and polyclonal gammopathies. The method is used to detect abnormal proteins also, such as myeloma protein in human serum. The medical diagnostic use is of value where certain proteins are suspected of being negligible or absent or overproduced. This method is useful to detect the purity of the antigen and antibody, and to identify a single antigen in a mixture of antigens. It was earlier successfully used for qualitative analysis of M proteins in serum and urine. It also aids in the diagnosis and evaluation of the therapeutic response in many disease states affecting the immune system. High resolution power and the fact that a number of antigens can be identified in serum are its advantages, but it is quite time consuming and sometimes a bit more difficult than other novel techniques. Moreover, it's not a quantitative technique. Although it may provide a rough idea about the antigen antibody quantities, and sometimes rapidly diffusing antibodies may mask the visualization of some smaller proteins, hence giving confusing results that may be tough to interpret. We sincerely hope that this description of the principle and how to practically perform IEP was understood clearly by our esteemed audience. We thank you for watching and appreciating our work. We shall be back with more immunodiagnostic techniques super soon, and keep learning. Take care and bye for now.